guys, good morning again. I'm back. I'm finally at my location. I'm at the hospital. I'm just waiting for a couple minutes before I walk up. I'm just trying to wait to see if any other classmates are gonna pull up so that they can walk up with me, because they kind of tell us, to be careful about walking by ourselves, kind of thing. So I do want to be careful and conscious about that. I got my hair pulled back. It's supposed to be off of our shoulders, which is mine, as you see, is nowhere near on my shoulders kind of thing. So I'm gonna basically throw on some lip gloss because I hate having dry lips. I like to be early because if you're early, baby, you're never late, and that's just how I roll. So I'm gonna definitely do that. Hopefully one of my other classmates will pop up so that I don't have to walk by myself. But if I gotta walk by myself, I'm walking by myself, because as you can see, we do got a little bit of light out. So that'll be okay. Hopefully I'll be able to take you guys a little bit on my walk kind of thing. I'm hoping I will be able to. I'm gonna see as much footage as I can get going into the hospital and coming back out kind of thing. But this is a long shift. I won't have a walkout until 6 o'clock p.m. And right now it's not even 6 o'clock a.m. yet. So long day, and I hope everything goes well. And you guys, I'll call you back. Okay guys, this is my short walk. To get to the hospital where I gotta go in. Clearly I'm leaving early because I don't want to be late again. So all right guys, what's up? It's me. I'm back. My shift is over. Oh, hallelujah. Hallelujah. Hold on, because I'm so hot. I feel like I had to walk a mile. Let me put my glasses back on. All right, friends. I had a good day. Yeah, I had a good day. Now, let me get up out of here. That's one of the worst things is afterwards walking. Sometimes I feel like I'm so short, I can tell you right now, I don't like my camera being like this. But it just is what it is. Okay, so like I told you guys, it's hard for me to get really good footage from the facility, because like I said, when I'm walking or whatever, I'm always talking. We're always talking, so I don't get to really get footage when I'm leaving. Perhaps the day that I don't have as many people to talk to, kind of thing, I will probably be able to get better footage. So I'm tired, but I'm not drawn out tired. I'll tell you today, since I passed dosage calculations, today I was able to administer medication, in which I had 2 injections. I had a heparin that I did, and I also had an insulin that I did, and I also had I had a few pills that I did, quite a bit of pills. I also administered a gel that's for pain, which that's something that you rub onto the patient's area that they are experiencing pain. So I did that. All of it was interesting. None of it was hard. It's just about doing it on a regular basis so you can get used to doing it. So I'm trying to figure out what I'm going to pick up to eat for me and the kids. I myself probably not going to even eat much, because for lunch I had a turkey burger. That's it. I didn't have no fries, just a turkey burger. So I don't want to eat too much because I don't want to be too sleepy or whatever. And for some reason I kept great energy today. So that's great, because the first day I did get tired after I had ate lunch, but I had a burger, had fries kind of thing, and today I was like, I'm not doing that kind of thing. So, but to drink, I did have a Olipop. I think it was like a blueberry Olipop or something. It was so good, and it just sucks that I didn't even get to finish drinking it, because it was an open can kind of thing. So I just had to drink as much as I could drink and then discard it, kind of thing. So I wasn't necessarily happy about that, but that's what I did. So there's a car that's speeding down here, and I don't even know why. That's one thing about this area that I live in, is that people will just like super speed for like no reason. So like this car came all the way from the back, the car that's in the left lane, speeding just to get up here. For what reason, I don't even know, but there's a lot of accidents here because of the fact that people are speeding. So other things that I did today, Again, I only had 1 patient today, which this is nice for Med-Surg that we only have 1 patient, because I'm wondering if some of the other floors is going to do the same thing, just give us 1 patient. Because, like I said, rehab last semester, I definitely had 2 patients. And I'd say I had more than 2 patients because we also helped out other patients and stuff. So, but it's okay. I was seeing that the particular hospital I do clinicals at, they got some positions that they're hiring for, and one of the positions, I don't remember which position it was, it said the ratio was 1 to 6. So basically 1 nurse to 6 patients. Yeah, I don't know about all of that. Because now that right there isn't easy, you know. Definitely. So I was thinking, the nurse that I had today, I was wondering how many patients did he have. I didn't even ask him how many patients that he had. But I did see that they were hiring for somewhere at the hospital for one of the floors, and the patient ratio is 1 to 6. So crazy. I really want to put my hair down because I got it pent up or whatever, but it is what it is. So I have to say that basically that's kind of how my day went. Nothing spectacular, nothing over the top. It was just a day. But nonetheless, I'm happy that it's over because I'm gonna eat, gonna relax. I know I'm gonna relax because it's 6:37, but I definitely later tonight, I am gonna study. I might do an assignment too because I like to stay ahead on my assignments. Or I don't know, I might just focus on studying because I have an exam on Thursday. What I like about going to clinicals is that today my patient had hypothyroidism. And hypothyroidism is a subject that we've been going over because it is going to be on our exam. Hypo and hyperthyroidism. So because my patient actually had that, I was able to firsthand go over that, and get an accurate feel and knowledge of that. So I definitely was happy about that. So that helped just to really beat it into me, help me reiterate it, help me practice the information that I needed to practice and know pertaining to that subject, and now it's in my brain. So I'm happy about that because that was one of them that I was like, okay, how am I going to remember this? And so after today, I definitely have it remembered. So that definitely was helpful. So that's something that will happen, with this whole clinicals. You're going to be seeing this stuff firsthand. You're going to have patients that are going to be experiencing the things that we are learning. So that's fine. Wait, I have to get over. So that was how that went. So yeah, I'm not going to really hold you. I'm ready to go home. I'm just going to make a stop, grab something to eat, particularly for the kids, and then I'm gonna go home. I'm going to relax, take my shoes off, put my feet up, kind of thing, and definitely take a relaxation. If you are looking for shoes for nursing school, or if you are a nurse already and you're looking for comfortable shoes, Clove, CLOVE, are by far one of the best shoes. I've had this particular pair of Cloves since I was working at dialysis. So before I even started in the nursing program last year ago, these shoes are still holding up. My feet are still comfortable. I mean, it's like the end of the day, and the first thing that I'm not complaining about is my feet hurting, because that's not even an issue. My feet are not even hurting, and so that's wonderful. Wonderful. So, and I will tell you this, the thing about nursing and working in dialysis, working in nursing is way more relaxing and way more less trauma on your feet, because you don't have to stand as much, because you do get plenty of chances to have a sit down. So, all right, I'll call you guys back. I gotta order my food. Bye.